Hi everyone, welcome back to Cares. Today we're diving into a drug you've probably seen on your patients' oncology lists, Darzalex or Daratumumab. Even if you're not an oncologist, if you're a PCP, you need to know what this drug does and what red flags to look for.
Absolutely. It's becoming a backbone therapy for multiple myeloma. And if you're managing patients post-treatment or co-managing chronic issues, Darzalex is one of those meds you'll want on your radar.
Let's start from the top. What exactly is Darzalex?
Darzalex is a monoclonal antibody that targets CD38, a surface protein found in high amounts on multiple myeloma cells. By binding to CD38, it marks the cancer cells for immune destruction, kind of like putting a spotlight on them.
So it helps the immune system recognize and eliminate cancer cells more efficiently?
Exactly. Through mechanisms like ADCC, CDC, and direct apoptosis, it actively clears malignant plasma cells.
Who typically gets this drug?
It's used both in newly diagnosed and relapsed or refractory multiple myeloma. Darzalex is often combined with agents like lenalidomide, bortezomib, or dexamethasone.
So it's rarely used alone?
Correct, it's part of a combo. Think DRD, DVMP, or DKD regimens.
As a primary care provider, what side effects or complications should I be watching for?
Great question. The number one issue is infusion-related reactions, especially during the first intravenous dose. You might see cough, chills, mild hypotension, or even bronchospasm. We pre-medicate to reduce this, but you might still see patients with post-infusion symptoms.
Got it. What else?
Also, immunosuppression, which means neutropenia, anemia, and infections. You may see patients with frequent upper respiratory infections, pneumonia, or fatigue.
What about blood typing issues?
Ah yes, that's a very specific point. Darzalex binds to CD38 on red cells, which can interfere with indirect Coombs testing. So if your patient is getting transfused, always tell the blood bank they're on Darzalex.
I've heard there's a subcutaneous version too.
Yes, it's called Darzalex Faspro. It combines Daratumumab with hyaluronidase for subcutaneous injection. Takes just 5 minutes instead of hours with intravenous. There are fewer infusion-related reactions too, and honestly, patients prefer it.
So let me try to summarize for primary care providers. Darzalex targets CD38 to help the immune system kill myeloma cells. It's used in combination regimens, both for new and relapsed cases. Watch for infections, anemia, and infusion-related reactions. Always inform the blood bank if the patient is on Darzalex. The Faspro version offers easier subcutaneous dosing.
Perfect summary. If your myeloma patient comes in with fever, fatigue, or cough, don't just write it off. And if you're co-managing with oncology, communication is key.
Thanks for breaking that down. This really helps us connect the dots outside oncology.
Happy to help. And remember, understanding these therapies makes us better partners in care.
If you found this helpful, please consider subscribing to Cares. Your support helps us keep creating medical content tailored for real-world practice. Thanks for watching, and see you next time.